Hi, it's Jane, and on Healthier You today, we're going to talk a little bit about fibromyalgia. My favorite, but not favorite subject. Okay, medical disclaimer first. Always check with your physician before starting any exercise or dietary program. Also, keep in mind, I'm not diagnosing you. You should not diagnose. Information here is my personal research into different health topics and is not to be considered medical advice. If you have questions, you should see your physician or your healthcare people for it. All right. According to the Mayo Clinic, fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain and spinal cord process painful and non-painful signals. Symptoms often begin after an event, such as a physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering event. Women are more likely to develop it than men. Many people who have it also have tension headaches, temporomandibular joint disorders, TMJ, irritable bowel syndrome, anxiety, and depression. Gee, I wonder why that would happen. While there is no cure for fibromyalgia, a variety of medications can help control the symptoms. Exercise, relaxation, and stress reduction measures also may help. So, what are the symptoms? Sorry about that, nose itching. Got a cat hair. The primary symptoms of fibromyalgia include widespread pain. Pain associated with fibromyalgia often is described as a constant dull ache that has lasted for at least 3 months. To be considered widespread, the pain must occur on both sides of your body and above and below your waist. Fatigue. People with fibromyalgia often awaken tired even though they reported sleeping for long periods of time. Sleep is often disrupted by pain, and many patients with fibromyalgia have other sleep disorders such as restless leg syndrome and sleep apnea. Cognitive difficulties, a symptom commonly referred to as fibrofog, impairs the ability to focus, pay attention, and concentrate on mental tasks. Need to get a drink. Fibromyalgia often coexists with other conditions such as irritable bowel syndrome, chronic fatigue syndrome, migraine, and other types of headaches, interstitial cystitis or painful bladder syndrome, temporomandibular joint disorders, TMJ, anxiety, depression, postural tachycardia syndrome. Causes. Many researchers believe that repeated nerve stimulation causes the brain, spinal cord of people with fibromyalgia to change. This change involves an abnormal increase in levels of certain chemicals in the brain that signal pain. In addition, the brain's pain receptors seem to develop a sort of memory of the pain and become sensitized, meaning they can overreact to painful and non-painful signals. There are likely many factors that lead to these changes, including, this is my favorite, genetics. because fibromyalgia tends to run in families. There may be certain genetic mutations that make you more susceptible to developing the disorder. Infections. Some illnesses appear to trigger or aggravate fibromyalgia. Physical or emotional events. Fibromyalgia can sometimes be triggered by a physical event, such as a car accident. Prolonged psychological stress may also trigger the condition. Risk factors. There are some. Your sex, since it's diagnosed in women more often than men. Family history. You may be more likely to develop fibromyalgia if a parent or sibling also has the condition. If you have osteoarthritis, rheumatoid arthritis, or lupus, you may be more likely to develop fibromyalgia. The pain, fatigue, and poor sleep quality associated with fibromyalgia can interfere with your ability to function at home or on the job. Frustration of dealing with an often misunderstood condition also can result in depression and health-related anxiety. And that came from the Mayo Clinic. Now, when you are getting diagnosed, and this also comes, does it come from the neurological disorder? I think so. There are no definitive tests to actually determine, you can't take a blood test to say you have fibromyalgia. And that's part of the problem with trying to diagnose it. I have had this most likely my entire life. And I will tell you why I say that. Even as a child, when they always say that you get a runner's high when you're out doing physical activities, I never got that runner's high, ever. Even when we were running track and everything else. Not ever. But it always followed. Then the next day or two, I was in such pain that I could not focus well. And I do remember that as a child, from the time I was about 5 on, that I recall. So for diagnosis, in the past, doctors would check 18 specific points on a person's body to see how many of them were painful when pressed firmly. Newer guidelines from the American College of Rheumatology don't require a tender point exam. I had one of those. My rheumatologist determined out of the 15 places that he touched, I was reactive to 11, possibly 12. So I got a high score. Instead, the main factor needed for fibromyalgia nowadays is widespread pain throughout your body for at least 3 months. To meet the criteria, you must have had pain in at least 4 of the 5 areas. Left upper region, including shoulder, arm, or jaw. Right upper region, including shoulder, arm, or jaw. Left lower region, including hip, buttock, or leg. Right lower region, including hip, buttock, or leg. Axial region, which includes neck, back, chest, or abdomen. And there are some things that your doctor is going to run some other tests that may have similar symptoms. Some of those blood tests include complete blood count, erythrocyte sedimentation rate. Mine is always elevated. My doctor says it's probably allergies. I think it's probably this. Citrullonated peptide test, rheumatoid factor, thyroid function test, anti-nuclear antibody, celiac serology, vitamin D deficiency. But then there's also an idea that if you are having some sleep apnea, your doctor will recommend an overnight sleep study. Now, my rheumatologist, when we were discussing the fibromyalgia, immediately asked for a sleep study, not only because of the pain that I was experiencing and the way that I had reacted, but when they did a physical look-see, they said that my neck region and the interior throat, those kind of things, were smaller than normal. Can you believe that? Smaller than normal. Once again, petite strikes. So I did have a sleep study, and of course, that sleep study was a total disaster. It was done in the hospital in Geisinger in Danville, Pennsylvania. When I went in, the gal that was the technician running the test was sick. She was coughing. They attach all these electrodes here, there, and everywhere. They put me in an egg crate bed that was the most uncomfortable thing to sleep in. She elevated my head and did some other things with my legs. And I said to her, "This is not comfortable. I'm not going to sleep in this. I can't sleep like this." She said, "Well, this is the position we need you to sleep in. It's uncomfortable." I have always had a fan on me at night. No fan. She finally did find a fan, bring it in to help. And I could not get to sleep. They want you to go to bed at 9:30 at night. I was staying up till 11:30 or midnight. So, I kind of laid there in the bed and finally kind of drifted off a little bit. Then I was awakened by her coughing. I was awakened by the slamming of doors, cabinets outside the room. Helicopter came in 4 times. My room was just outside of it was the helipad. So the sleep study, as the doctor, when he came in, he was exasperated. He was kind of in a pissy mood, really. And he said to me, "Why didn't you sleep?" I said, "Who could with all the noise going on?" So he was pretty pissy about it, and he goes, "We just don't get restorative sleep." And they just left it at that. Until, of course, when I saw the cardiologist because of the concerns in my EKG, she had asked for another sleep study, and of course, they did the sleep study and found my oxygen level goes down to 60%. I don't really stop breathing. It's just my oxygen level goes down, so there's a little bit of an obstruction there. So that's considered sleep apnea, which is fine. And, of course, when I saw her again, she said, "That explains the EKG and the things we're seeing. Let's just continue, and I'll see you again in a year." So, yeah, sleep studies. I would always suggest to people from now on to do a home sleep study. Treatment. In general, treatments for fibromyalgia include both medication and self-care strategies. The emphasis is on minimizing symptoms, improving general health. No one treatment works for all symptoms, but trying a variety of treatment strategies can have a cumulative effect. Medications. Medications can help reduce the pain of fibromyalgia and improve sleep. Common choices are over-the-counter pain relievers, such as Tylenol, ibuprofen, naproxen sodium, Aleve, those kind of things. Opioid medications are not recommended because they can lead to significant side effects and dependence and will worsen the pain over time. Although, to be honest, I don't think that every once in a while it's painful. I think they should give you one, maybe 1 pill a month. Antidepressants. Duloxetine, Cymbalta, and Savella may help ease the pain, fatigue associated with fibromyalgia. Now, your doctor may also prescribe amitriptyline or muscle relaxant to help promote sleep. My rheumatologist put me on a muscle relaxant, and it did help me with a lot of the sleep issues. Of course, they were doing, can't think of the name of it now. Methylcarbonyl. But when I turned 60, no, when I turned 65, the drug companies came out and said, that's not good for older people because they'll lose balance and all this other stuff. So they put me on baclofen, which as far as I'm concerned, baclofen is useless. Doesn't help with anything, doesn't help with back pain, doesn't help with muscle spasms, doesn't help with squat. At least it doesn't in me. So there you go. Anti-seizure drugs. And this is something my doctor wanted me to put me on. And if you followed last week's video about the Chiari malformation and syringomyelia, you already know a little bit about this drug. Medications used to help reduce certain types of pain, gabapentin, sometimes helpful in reducing fibromyalgia symptoms, which I was not willing to take. The other one is Lyrica, which was the first drug that was approved by FDA to treat fibromyalgia. Now, I have refused to take the Lyrica, to even try it, because you get into an even more of a brain fog with that drug. And everyone I know that has been on it, you start out at a low dose and then you have to keep going higher and higher. Your brain fog gets worse and worse. And I just was not willing to give it a shot. So, therapies. Variety of different therapies can help reduce the effect from fibromyalgia, which includes physical therapy. Physical therapists can teach you exercises that will improve your strength, flexibility, and stamina. Water-based exercises may be particularly helpful. Occupational therapy. Occupational therapists can help you make adjustments to your work area, the way you perform certain tasks that can cause less stress on your body. Counseling. Talking with a counselor can help strengthen your belief in your abilities and teach you strategies for dealing with stressful situations. Now, causes of it, we kind of touched a little bit on that, but this one I found a little bit interesting. Like I said, I have had doctors tell me that it is a sleep disorder. I have had doctors tell me it is neurons firing in your brain that are off the wall. Your nerve endings are in different pathways than what others are. In other words, the nerves in your body run a different path than most people. But I'm going to tell you what the newest thing is. The cause of fibromyalgia is not known, but studies show that people with the disorder have an increased sensitivity to pain, so they feel pain when others do not. Brain imaging studies and other research have uncovered evidence of altered signaling in neural pathways that transmit and receive pain in people with fibromyalgia. These changes may also contribute to fatigue, sleep troubles, and fibrofog issues that many people with the disorder experience. They do know that it tends to run in families, so a genetic factor is likely as well, but it's not known for sure if there are specific genes that play a role. So researchers also believe that environmental factors also play a role in a person's risk of developing the disorder. These environmental triggers may include having a disease that causes pain, such as rheumatoid arthritis, or mental health problems, such as anxiety or depression. Now, one thing I have talked with a lot of other people that I know that have fibromyalgia, some of us do not have the extent that others do. Some of us have lesser degrees, some of us have more. But a couple of the ladies that I work with at the church, that we all have fibromyalgia, we all talk about things that will cause a flare-up. Illness always causes a flare-up. We also have talked about how excess sugar in our diet will cause a flare-up, and it does. And all of us talk about, we all have sweet tooth. So we're just fighting against our bodies, right? And out of 4 of us that I've talked with that have fibromyalgia, 3 of us, when we sometimes have a flare-up, that because a lot of people, they don't understand it. And they say, what are you talking about? You don't look sick. You don't look ill. They don't understand that you may feel bruised in places in your body that shouldn't be bruised, or you may feel just general pain all over. And it's hard to describe to someone who does not experience it. But out of us, the 4 that I've talked with, 3 of us also occasionally have this, where our clothes feel like they are full of shards of glass. So we'd rather be naked than wearing clothes because of that shards of glass in our body. Now, I have it happen sometimes all over my body. Sometimes it's just my arms. Sometimes it's just my legs. What I find the funniest is when it happens, and it's mostly in my bra. And I'll tell you why I find that funny. Because if I take the bra off, I don't have that glass shard feeling in the area where my bra is. So that's what I find rather interesting, how that works, and I'm not sure what that is. But we all talked about it, and we also talked about how when we are in a flare-up, we tend to be sleepy and sleep a lot. And that is true for all of us that I've talked with that have fibromyalgia. So there you have it in a nutshell. Yeah, I'll be coming up with another subject next week. Don't know what it is. But in the meantime, everybody have a great week. Try to remember to do something kind for yourself or for someone else. Bye for now.